Now that we've talked about traumatic problems, let's review. The first thing you have to remember about trauma is there needs to be a precipitating event, meaning that if a patient didn't fall, wasn't hit by something, didn't have some sort of impact or incident, then it's not trauma. It's a great way to eliminate a whole section of problems. If you come up to your patient and you say, "Did you fall? Did you get hit?" and they say no, they do not have a traumatic injury. So ensure that there's a precipitating event. We talked about sprains, strains, fractures, and dislocations. Lower leg injuries are the most common injuries that you're going to find in the backcountry. Sprains in particular. Use your diagnostic tool to say, is this a sprain, a strain, a fracture, or a dislocation? Evaluate them thoroughly, treat them properly, and make sure that you're reevaluating these orthopedic injuries continuously, especially if you have long evacuations or you're going to be with your patient for extended periods of time. Head trauma. Do not mess around. If a patient has any changes in mental status, that is an immediate evacuation. Nothing else about it. Chest trauma. Your main concern is breathing difficulties. Chest trauma isn't always that bad, but you have to pay attention to how they're breathing. When it comes to chest trauma, patients are going to have a hard time. Depending on the extent of the trauma, it can cause them to have a very high work of breathing. Make sure you pay attention and monitor. Traumatic abdominal injuries are extremely difficult to assess and manage in a backcountry setting. If you're not able to define a traumatic abdominal injury as being minor, don't wait, head out of the woods. This doesn't mean you always need a helicopter, but if you think that there is extensive damage, you need to get further care. There's very little that we can do in a backcountry setting for traumatic abdominal injuries. Soft tissue injuries are what you're going to see. We deal with cuts and scrapes and bumps and bruises and blisters all the time in the backcountry. Make sure that your first aid kit is prepped for dealing with soft tissue injuries, just like the one at American Outdoor School. Make sure that you're ready to clean wounds. It is the most important thing you can do for soft tissue injuries. Then change your dressings and bandages frequently and monitor, monitor, monitor.